You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, laser dentistry. With us, we have Utah's laser dentist, Dr. Cameron. Dr. Cameron, welcome to the program.
Thank you.
So you're using lasers for a lot of different things. I guess there's less downtime, less pain, less noise.
Absolutely.
For like root canals, fillings. What do you use it for?
You bet. Most common thing people think when they go to the dentist is a filling, right?
Yeah.
So laser, 9 times out of 10, we're using that instead of the drill. So people hate that noise, that whiny high pitch. We can get rid of it. Using the laser, sometimes they don't even need to get numb. And we just go in and little bits of tooth just disappear. And before they know it, often quicker than otherwise, they're done with their filling. Less pain, less noise. They love it.
Okay, good. Now, lots of laser questions here, by the way, because you're even doing like extractions.
Yeah.
And you're using lasers, things like that.
Yeah, we are.
But your practice, for people that don't know your practice, I guess you're a team of 3 dentists.
Yes.
What are the different services you offer?
So we start with the youngest patient we had, actually just a month ago, 1-week-old baby, lip tied, having trouble nursing.
What does lip tied mean?
Lip tie, you've got the tongue actually attached to the gums on the bottom of the mouth, so that they can't get a good swallow.
Okay.
So they're not eating well. So mom brought baby in. About 10 minutes later, we had the lip tie loosened up. Mom went, fed the baby. Baby was feeding great. So a simple procedure.
How do you loosen up?
Just with the laser. Just go in there, and baby's got little goggles on, mom's got glasses on, and just baby's in my lap and mom's lap. Just a couple minutes later, lip and tongue are loosened up, baby can eat. It was awesome. Mom was thrilled.
With the laser?
Absolutely. So no need for anesthetic on that. Baby's happy, baby's behaving totally normal. He almost slept through the whole thing.
Okay.
It was really awesome. Mom was so grateful. She tried so many things that just hadn't been enough. We got her fixed up.
So you do a lot of kids?
Mm-hmm. Yeah, we see a lot of kids.
What else are you doing over there?
So with kids, one of the other things that younger kids love is with the laser, like I said, 9 times out of 10, no need for numbing. Now, if they're highly anxious...
So for cavities?
Absolutely.
Okay.
I mean, if they're highly anxious, they may need a little extra help because anything's going to set them off. But an average kid just comes in with the laser, get them opened up, they watch a movie, they've got maybe the nitrous on, and we just get going, and before they know it, they're done, they haven't finished their show, and they're good to go. So then they go get their prize, and they're on their way out.
So the drilling, even for a simple procedure, that drilling, it goes on in your head, it's terrible. So that's like eliminated, that part.
Yeah, that part can be...
It vibrates in your
That part
head.
can be eliminated.
Right.
I remember even when I was in school, that was one thing we were all talking about. How do you get rid of the noise of the drill? You can't do it. You can't do it with a movie. You can't do it with headphones. Nothing stops that piercing noise. And I know people hate it. I hate it. I work around it. So
Okay.
the laser, sometimes we say it sounds like popcorn. There's like a little popping noise, but easy to overcome with headphones, with a movie. It's not as bothersome because it doesn't bring those same emotions. And it works amazing.
So look for a dentist then. That means if you're going to get a cavity taken care of or whatever, especially parents watching this, look for a laser dentist.
Absolutely.
Is this rare? I mean, not a lot of dentists are doing this, right?
It's not. It's still pretty uncommon. I mean, they're out there, but it's still pretty uncommon. I feel like, especially if you're a parent or you yourself have issues with the noise, hands down, look for a laser dentist. It's going to be a better experience for you.
You were born and raised in Utah?
Yeah, I was born and raised in Salt Lake City. Love the place, love the people.
And you take care of some of your friends from high school?
Yeah, I've got, actually just last weekend I had a college roommate. He brings his wife and kids up. They drive 2 hours to come see me. Just a good friend, and it's really fun to take care of.
You seem like a likable guy. I mean, young guy, right?
Sure, yeah.
Do they even tell you, hey, no offense, I don't like coming to the dentist?
Oh, absolutely. That at least once a week, someone says that. And it's just, hey, no offense taken. I don't like the dentist either. No,
Yeah.
it's just a joke. But let's be honest, Randy. No one loves going to the dentist.
Right.
It's just what.
I mean, secretly we go there and we're hoping we never have to see you again.
Absolutely.
Right.
That's a joke I always tell patients when they leave is, hey, I hope I don't see you again until it's time for your cleaning. Because that means that nothing's broken, nothing's hurting. That's what we want. We want people feeling healthy and good about their smile and their mouth.
Now, for adults, what are you doing?
So with adults, we do fillings like for kids with the laser. Again, a lot of the time they don't need to get numb. That noise is not nearly the annoying noise of the drill, and that's what we do the most of because that's what we do a lot in our general practice or fillings. But also, root canals. When I do a root canal, the goal of a root canal is so that tooth never hurts again, right?
Right.
That's
okay.
all based on how we clean that thing out and how we take care of it and seal it up. There's no better way to clean out a tooth than using the laser to activate the irrigants we put in a tooth to kill all the bacteria inside the tooth. Research is showing more and more that it is the most definitive way to clean a root canal with our irrigants is with a laser.
A lot of stuff on the internet about the dangers of a root canal. I guess
Okay.
you're digging into the
Yeah,
tooth,
I mean, you got to open up the tooth to get into
and you could get into the
canal.
person's bloodstream. That bacteria goes in the bloodstream with the laser. Just so I understand, because you explained this to me, by the way, on the telephone. Mm-hmm. And I've done limited research, but so the laser disinfects the area?
Yeah, so you take the laser in, you're filling that whole system with some irrigants that help clean and kill the bacteria. The laser just enters the very tip of that, and it sends a supersonic pulse through that water that helps move everything around and clear all that bacteria out so we can take it out up the top where we have our access to keep it clean and then seal it up and they're done.
So a comfortable root canal.
Yeah.
People like getting root canals.
Well, I don't know if I'd go quite that far that people like getting root canals, but yeah, the best chance of success getting all that bacteria cleaned out is with laser activated irrigation. I mean, there's no better way. So another thing we do, Randy, is crowns in a day. When I first started I've known since I started practice that I wanted to be able to provide this service. To have someone come in when they need a crown, they need that tooth restored that way, that we can get them in and out in a couple hours and they're done. Because
So you have a machine that actually makes it right there?
Absolutely.
Okay.
My goal has been to make it easier for people to get the care that they need. So people take time out of their busy schedules, moms, dads, people working, people with kids, everyone. No one likes to have to take extra time out of their day to come to the dentist. So if there's a way that we can get them all taken care of, we scan the teeth so we don't always have to stick that impression stuff in people's mouths that people gag on, they hate it, it takes
What do you mean
forever.
you scan the teeth?
So it's basically like a little wand. And it's a laser light that scans those teeth, and people actually love watching. You know, they're laying back in the chair and they're watching up on that screen, and they get to see the 3D model that I scan, and then I use that. They watch me design their crown. I send it to the milling unit. 10 minutes later, it goes in the furnace, comes out in 15 minutes, and it's done. And we put that crown in, they walk out the door, and they're done. They don't have to come back. It's great, and it's, in my opinion, when it works, and you can't use it all the time, but most of the time when you can, it's a better service for the patient.
So how is it normally done?
So normally you come in. You get
this is the way it goes on in most dental offices in Utah. Okay.
Absolutely. So you get your crown prepared the same way, but then you get an impression in your mouth. It's that stuff that a lot of people don't like, that they gag on. They sit there closed forever, and then you take it out. That gets sent off to a lab. We make a temporary crown that's in there for about 2 weeks. 2 weeks later, they come back in. You got to get the temporary taken off. Sometimes they have to get numb again, and then the crown put on, which works.
So that's how it's normally done. Like
Yeah.
in Utah, that's typical. Like 90% of the time,
Yeah.
you go in to get a crown, it's sent out, you
Yep.
wait, you come back.
Yeah, and I've always
Interesting.
felt like nothing good happens in those 2 weeks when you've got a temporary crown on. Your gums get irritated. It may pop off. You have to come back in to get it put back on. I want to reduce the hassle. That's what we're going for. We want to make it easier to get done whatever you need done. So when you can come in and within 2 hours, you're out and you're done, I think that's a great service.
Same day crowns.
Yep.
Do you advertise like about that? Because I hear things
Yeah.
like same day crowns, but I always feel like it's an exaggeration.
Yeah,
it's
I mean,
not.
It's not an exaggeration. We put it on some of the stuff we put out there to let people know.
Okay.
I mean, we just want to make it easier. Again, people don't love seeing me, right?
All right.
So if we can make it easier for them, I think that's a win.
Now you do sedation dentistry in your practice.
Yeah.
Tell me about that. I mean, who's going for that?
So, well, like you said, no one likes seeing the dentist, right? If they're nervous about something, there's a wide range of sedation options we can provide in our office. Anything from the laughing gas that people love, makes them feel more comfortable, to a pill they take. Someone brings them in, they've taken the pill, and we can give them stuff strong enough that they probably won't remember anything afterwards. Or they come in, they get the full IV sedation. Dr. Carter that works for me, he does that. And it just provides all the options so people can be comfortable.
So for bigger procedures,
Yeah.
IV sedation.
Yeah, bigger procedures. And a lot of people hear, oh, if I'm getting my wisdom teeth out, I want knocked out, right? So he can do the IV sedation for those wisdom teeth cases that want that service, so that they're.
So you do wisdom teeth.
Oh yeah, we do those. We do wisdom teeth a lot. So both Dr. Carter and I are taking at least a couple cases every week, and we have some people that are just numb and get them out, and other people that are, they've got the IV sedation, they get them out. But it goes really well. And again, makes it easier that you got one place to come and you can get pretty much everything you need done.
Now, oral surgeons normally do wisdom teeth, right?
Absolutely. Yeah.
And they're obviously very competent in doing wisdom teeth.
Absolutely.
And so you've had additional training for wisdom teeth.
Oh yeah. Oh yeah. I mean, anytime you do something else, you want to get additional
So
training.
beyond after dental school,
Oh yeah.
is there really that much to that?
Well,
Wisdom teeth?
you know, it's always the what to do if things don't go exactly as planned. That's
All
what
right.
you want all that additional training for. So you know how to take care of someone should it not be your standard case.
Are you less expensive than maybe a specialist?
Oh, well, yeah. I mean, a general dentist is always less expensive than
So you're going to be
a
less
specialist.
expensive. Interesting. Very interesting.
Another thing we offer in our practice is orthodontics. So traditional braces, Invisalign, you know, clear aligners, whatever people need. Anywhere from the young kids who they're at that age where all their friends are starting to get braces, they've got something crooked, their bite's not right, we can help them with that. Again, Dr. Carter and I do that. The clear aligners, all three of us are working on those, so we can do pretty much anything a family might need.
So orthodontics you do, the traditional braces.
Yep.
And what about Invisalign? So you do like Invisalign or something like that?
Yeah, Invisalign, ClearCorrect, they're both clear aligners that we use to straighten teeth. The most common we see with those are people that had braces when they were younger, they didn't wear their retainers, things have gone crooked again.
Okay.
But they're at the age where they don't want brackets on again, so we help them out with clear aligners. They're all straightened back up and they are committed to their retainers after that, I tell you what.
Now what about adults?
So,
more and more adults coming in for
yeah, you know, more and more
orthodontics?
adults are just aware that it's available to them and that it's worth doing. I
Okay.
mean, almost every adult experiences, particularly on the bottom, a little bit of that crowding. We actually call it adult onset crowding. Things just drift a little bit over time, and they just want to get it fixed back up. Either it's hard for them to floss. You know, we let them know, hey,
Yeah, the bottom teeth seem to shift.
they shift and they get more tartar on there, more calculus, and it's just harder to keep it clean. So yeah, either with clear aligners, which is where most adults want to go, or if they want brackets or it's just going to work better for them, we can do that and get those teeth straightened back up so they've got a healthy smile, an easy to maintain smile, which is important, especially for adults, and they just smile more. And then you've got the adults.
I mean, you say that people, that their lives are transformed
Absolutely.
by taking care of their teeth.
Yeah.
Elaborate on that.
So we've all met someone, right, that doesn't smile. And it's not that they're not a happy person. There's just something about their smile they don't like. They may not even be aware of it. They just don't smile.
Okay.
So sometimes it's a simple fix. Maybe their teeth just aren't the right color. Okay. Grandma came in a couple years ago and told me, I want my teeth whitened. I said, well, what turned you on to that? Well, my grandkids asked me why my teeth were so yellow. So absolutely, we get them cleaned up, we get their teeth whitened, all of a sudden they're smiling confidently. And it does change things. When someone starts smiling that has not been smiling, people start asking, like, what'd you do? Well, I got my teeth fixed. I like to smile now. Another popular thing that we do quite often are dental implants. So someone comes in with a tooth that's broken down, no longer savable, but they don't want to be missing that tooth. You know, we'll get the bad one out, or if it's already gone, we just look at what we've got.
So a single tooth.
Yeah.
Now, why is a dental implant better if you're just missing one tooth?
So you've got two options if you're missing one tooth, an implant or a bridge. Okay? A bridge is going to use the two teeth beside the open space. They're going to be anchors for that bridge. The biggest issue is we do a lot of fillings because people don't floss, Randy, right? And when you do a bridge, you've got to floss. Otherwise, you're going to lose those two. And so long-term cost, long-term care, implants are just better. It's a single tooth solution for a single tooth problem. It's done. They don't get cavities. And they're solid.
Is it less in the long run?
Oh yeah.
Over a bridge?
Oh, absolutely less in the long run because it's not going to be replaced like a bridge often is. You know, a bridge, the most common reason it's replaced is because of cavities. So if we can do something that's not going to get a cavity and it's going to last you the rest of your life, no question, it's going to be less of an investment for them to replace that missing tooth.
So you're doing a lot of implants in your practice?
Absolutely, yeah, we are. And you know, we've got them anywhere from that one tooth to maybe a couple teeth to support an implant bridge. If they're missing teeth, they've missed them for a long time. And people get really excited when they realize that it's not as hard as they think it is. People are kind of scared. Implants, that sounds scary. It's really not.
Okay.
It's less traumatic than getting a tooth taken out, and the benefits are a lot better. Then it's not just, you know, I've got a tooth back that I can actually eat with, where I haven't been able to chew for a long time.
So moving on to the topic of laser dentistry, you're using it for cosmetic reasons too.
Absolutely.
Like, give me an example.
So one example, you know, you've got someone that they've got those front two teeth that just won't come together. and they've always had that gap, and they don't like that gap. Oftentimes, the reason for that gap is they've got gum in the way, a little bit of muscle attachment there that needs to be moved out of the way. Lasers are a great way to go with that, so they can get that smile and those teeth will close. Just go in again. Oftentimes, you don't need a shot, which is great.
So in between the front two teeth,
Yeah.
they kind of have gum tissue
Yes.
that's hanging a little bit low.
Some strong gum tissue tied up so it will not let those teeth close. So a little bit of some of that.
You just kind of zap it.
Yeah, we put some of that topical anesthetic on there that there's no shot involved, and just slowly paint that away until it's gone, and you're done.
But what about the teeth? What brings them back together?
Sometimes they'll actually, if they're younger, they'll actually close on their own. And if not, and it's an adult, then we'll go ahead and close them with braces or with Invisalign. But I mean, I've had cases in the past before I really understood that we closed it up, it bounced right back open.
Okay.
And so we had to get rid of that area.
But to close a gap, if it's small,
yeah.
with Invisalign, that could take like a month.
Oh yeah,
right?
yeah, a couple
not
months
long.
max. Yeah, it's quick. If there's nothing in its way, it can go really quickly. Now, not everyone has that, but oftentimes when we're looking at it, why the gap? It's because there's something in the way.
Is that right?
Yeah, so it's great with the laser. Like I said, most things, especially when you're working with the gums, maybe some topical anesthetic, maybe, if they're really sensitive, and very little bleeding.
So the laser doesn't really hurt?
No.
Because it's hot, right?
No,
Obviously.
no, laser's not hot.
Oh, the
So-
laser's not hot?
No, so you got different kinds of lasers.
Right.
Okay, so we've got two lasers that I work with, and one of them there's no heat involved. Tissue just kind of disappears.
Well, what's the mechanism? I mean, how's it working?
Well, it's the erbium laser that I use. It's absorbed by water,
Okay.
and when the water absorbs that energy, it just vaporizes essentially.
Oh, I see.
And so I get to watch, and it's coolest for me. I just get to watch things just disappear as I go. I've got my aiming beam. I know where I'm working, and I just watch it disappear. I watch those gums just give way, and it's done.
So you're taking care of gummy smiles with the laser.
Yeah, yeah. So I mean, when people show too much gum, Randy, they're a little self-conscious, right? They guard their smile because when they smile big, you see too much gums. Maybe the teeth are just too small because the gums are too big, and we can take care of that. What do you mean small teeth? So sometimes the teeth look small because there's so much gum, or maybe the teeth are covered by too much gum. We just need to uncover them, take that out so it all looks proportional, and they feel confident when they smile. And so we can with the laser, it's really easy to move those gums back, get the teeth.
You just kind of trim
the
gums.
And sometimes
with the
you're just kind of painting it away. Sometimes people's gums are just too thick, so you're just kind of painting it away, letting those beautiful teeth just come out and show up in that smile the way they should. And it's amazing to see how someone smiles when they're done. So when it's all done, you've got the gums trimmed back, and you hand someone that mirror, and they take a look, and they smile, and they see the beautiful smile they've always wanted right there. It's an awesome moment to see that they got what they always thought they wanted, and all it needed was their gums trimmed back. It looks like I got a brand new set of teeth.
So how it's normally done, though, so you're using a laser to take care of a gummy smile. How is it normally done?
I mean, normally you're going to go in there with a scalpel, which it works. You go in, you trim it all back, and you
don't
uncover
like
those
it
teeth.
that way?
You know, it all works, Randy, but for me, again, it's making it easier to get it done. Getting rid of the things people are afraid of. They're afraid of that time when they're not going to be able to smile because it hurts. So if we can make it heal faster, more quickly, and so they can smile sooner.
So
Why wouldn't
hands
we?
down, the laser is lower downtime
Oh, absolutely, absolutely.
than cutting away the gums.
Yeah, I mean, you look at our pictures, 3 days out, 5 days out, a week out, and within a week, it looks like it was born that way. And it's awesome. You know, whereas normally it's going to be a couple weeks. There's going to be more sutures involved and different things. They've got stitches, and it's just you can get the same result, but if you can get it done with less pain and less time, why wouldn't you, right?
So there's a lot of dentists, right? You must have buddies that are dentists.
Absolutely.
Maybe they're a little older than you, and they don't use the laser.
Sure.
Do you tell them, you got to get the laser?
Oh,
You gotta-
absolutely. Yeah, it's just
Why aren't they all doing it then?
well, they're used to the way they do it. They say, well, I've been doing this for so many years and it works, and absolutely it does. But they're not the one that goes home and hurts for weeks afterwards. It's their patient. You know, they're using a scalpel, they're using an electrosurge, something that just, it hurts for longer. And so they may not want to try it, or they're afraid of, what it would take to get a laser in their office. And I say, hey, once you've tried it, you won't do it another way.
Is that right?
Yeah, absolutely.
Is that the future of dentistry?
I think it is. I
Like
mean,
no more drilling?
I'm biased, but I think it is.
But very little drilling, like for cavities or whatever.
Absolutely. Minimize the things that make the dentist unpleasant. Laser's a great step in that direction.
All right. So let's talk about root canals, because you said that you use it on a root canal to what? I mean, why is it better, safer, faster, whatever?
Sure. So when you do a root canal, right, we're going to clean out that tooth. The goal is to kill everything bad in that tooth. And so we go in there and we take our files, we clean out, we shape, and then we irrigate with some liquids, right, to kill the bacteria in the tooth. Now, when we put that laser tip in there, it activates the solution. It actually makes it all like if you saw it in a clear cup, it just looks like it's all getting broken up everywhere. It's going actually into the tooth, microscopically into the tooth, killing the bacteria that's sitting there, cleaning it out. I mean, there's just no better way to reach those areas that we have a hard time reaching than a laser. And no one wants a root canal twice, Randy.
Do you call it a laser root canal?
Yeah, laser-assisted root canal. We've got words for it that we dentists use.
I mean, because you're making a statement that there's no better way. Is there really no better way?
No, there's no. All the science is now showing that the most effective cleaning of a root canal system is laser-assisted irrigation.
So if you've been told you need a root canal, I don't want to put words in your mouth here, but should you ask your dentist, are you going to use a laser during the procedure?
You ought to ask. I mean, why wouldn't you ask?
And if they don't do it, would you say maybe get a second opinion?
Yeah, I mean, I guess it depends on how comfortable you are with your dentist or whatnot.
We had this discussion in my green room that in where you are in Utah, a lot of people are loyal to their dentist, just like they are across the country.
Sure.
So people can switch to you for the laser treatment and still go back to their regular dentist.
Oh, absolutely. I mean, if it's something they say, that they hear about this and they say, okay, I want that done. They can come to me and get that done, and then they can go back to their regular dentist if that's where they're comfortable.
I think you mentioned in extractions, when you're removing teeth, you're using the laser.
Yeah.
What's the benefit there?
So, again, I keep coming back to it, but quicker healing, less pain afterwards. So when we do the laser, there are a few things we can do. We can actually stimulate the site before we take the tooth out to get the body's response going, to heal it faster. If we need to move the gums back, which we often do if the tooth's fairly broken down, we can do that with the laser rather than a scalpel. The mouth, everyone talks about how the mouth is such a dirty place, right? There's lots of bacteria in the mouth. Just like on our skin, it's on our gums. And when we take a scalpel through the gums to open it up, we're taking bacteria with us. The laser doesn't do that. It's killing bacteria as it contacts. So
are we talking about wisdom teeth right now, or just extractions in general?
Any teeth.
So
any teeth that need the gums moved back, the gums are going to have. They're going to take a scalpel in and open the gums, peel them back
to make it easier to pull out the tooth.
Right, or to get in a wisdom tooth where it may be buried. That's the only way to get it out. Is you've got to expose it so you can see it and get to it. But again, you take the laser to those gums, you get the same result, but with quicker healing, less pain. And then when I'm done taking a tooth out, the body's got to respond. It's got to fill up that hole with a clot. We can stimulate that with the laser, with the other laser that we have. It stimulates the clot formation, quickens the healing. Everything just goes more quickly. So
it doesn't cost more to go and use the laser?
No.
So there's
not in my office.
Okay, there's two types of extractions.
Sure.
Is that what you're saying? That some extractions, they got to go in with a scalpel, open up the gums.
Right.
So now you have downtime and it hurts.
Right.
Or you go in there with a laser, open it up that way.
Right.
Disinfect the area, pull out the tooth. Do you also disinfect the area once you pull it out?
Yeah. Disinfect it again and help get that clot formed so they can heal quicker, less chance of a dry socket. People have heard of that, hurts a lot. All those things we can do with the laser. Again, it's just quicker.
So every extraction should have a laser involved, in your opinion?
I think so. Again, like if you could heal quicker and more easily, wouldn't you want to?
People need to know, if they're tuning in, I'm not on your side here. I'm not trying to endorse you. I'm just asking the questions. But logically, this makes sense.
Well, yeah. I
mean, because when we get the medical doctors on the show, and the plastic surgeons and the dermatologists, everything is shifting toward lasers.
Absolutely.
So it's almost old school to not use lasers in a dental practice.
Right.
Is that right?
Yeah. I mean, that's where it's all going. Why? Because laser, it's light. There's nothing bad about it, and it's gonna make it go more easily. So why not? I mean, yeah, there are barriers for dentists to get into it, but
because is it hard to learn? Is there like a big learning curve?
There is definitely a learning curve. So it takes a while to get used to it. But I mean, and there's the expense for the dentist to get into it. But hey, I went into dentistry because I wanted to make it easier for people. because I had a bad experience with the dentist as a kid.
You did?
Absolutely, I hated my dentist. It was getting two teeth pulled. That, you know, he didn't care what I saw. I saw everything. It freaked me out. And he was just a grumpy guy.
And you knew at that moment you want to be a dentist?
Well, at that moment, I never want to see a dentist in my life.
Okay.
But later, when I decided, you know, I want to be a dentist, I want to make it better than what I went through. So that's been my whole goal with the same-day crowns, with the laser. I want to make it a better experience so that it's easier to get it done.
And fast.
And faster, absolutely.
So everything pretty much under one roof.
Yeah.
You do veneers. I mean, you pretty much do all of those things, and you have 2 other dentists that work there?
Yep.
They're a lot younger than you, the other dentists that are working there?
Absolutely. No, I'm definitely the youngest of
You
us.
say the guys that come in that are your age,
Yeah.
they come in as patients.
Yeah.
And what do they say to you?
Oh, the ones my age or younger are the ones that most often comment about my age and say, you're too young to be a dentist. I say, well, actually, you know, I'm still in high school, but just don't tell anyone, right? No, it's just a joke. But yeah, it's funny because it's the people my age that comment the most often. But we all do that, right? Because we don't feel old enough yet. So
we're out of time. Final message, and also give us a recap.
Sure.
That means somebody out there, they have some of these dental problems. So as a recap, what can the laser take care of?
So laser can take care of anything from their fillings to helping with their gums in a wide variety of procedures, from gummy smile to a lip tie to even when we're working on teeth for crowns or fillings, we can use the laser to adjust the gums as needed, to getting teeth removed and helping things heal more quickly. And heck, even cold sores, we can help fix those. It's just almost...
So if a cold sore for one of your patients is starting to come on,
oh yeah,
you zap it,
yeah,
it stops.
If they let me know when they first start feeling that tingling, we can zap that and it'll stop. It's not going to grow. Or if it's already started, we'll get it to go away faster, so they can get to that wedding photo that they've got coming up this weekend.
Okay,
you know,
good.
I had one of those last week. I got to be in the wedding photos. Can you take care of it? Absolutely. You know, so I touch the laser for almost every procedure I do, because I know that I can make it easier and heal more quickly if I use that tool in my toolbox.
So you
to help my
are
patient.
Utah's laser dentist. I said that at the top of the show. So you love it. Okay, good.
I absolutely love it.
All right. I want to thank you for coming to the show. Great
Absolutely.
info.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.